Today was a client check-in day for me. These are longer days for me and my brain gets a little bit tired, but they are one of my favorite days. I love touching base with my clients, and it got me thinking, because if your provider is not asking you about energy levels, how are your energy levels? How is your digestion? How are you sleeping at night? Looking at food journals. What are you eating throughout the day and just throughout the week? Looking at your habits. How are things going? What things are we doing on a day-to-day basis to support our fertility? And what things do we maybe need to adjust as far as like movement, stress, just different supportive, I call it therapeutic practices to support your fertility, because it's much deeper than just like live a healthier lifestyle. We're a lot more intentional with the process about that. But if we're not touching base on these things regularly, we cannot get you an effective fertility plan. That's just a matter of the fact. Depending on what program of mine you're in, the biggest difference between my programs is the level of support that you get, how frequently we are touching base on these things. But regardless, in my programs, we are always touching base on these things, because that's how we know what's working, what's not working, and we are continuing to adjust your plan to make sure it's as effective as possible in helping you get pregnant. That is exactly why I built out specifically Redefining Fertility the way that it is, because that was the biggest thing that was missing on my own fertility journey, where I would go meet with a functional provider, but then they'd say okay, take these supplements, see you later, see you in 30 or 60 days whenever you make another appointment. I'm like, okay, well, this is not helpful at all. So when I was creating my own programs, I'm like, this is going to be the biggest thing that's different about it, is I want to be available to help my clients throughout these day-to-day things and helping them with monitoring their own progress and helping them make the adjustments as we go, because that's how we get you an effective fertility plan.